If I told you that millions of adults over 65 are taking medications every day that quietly double their risk of falling, memory loss, or even hospitalization, without realizing it, would you check your medicine cabinet tonight? Because here's the truth most people miss: just because a drug is over the counter, doesn't mean it's safe after 65. And what I'm about to show you comes directly from clinical research used by doctors themselves. But before we get into the list, you need to understand one critical shift in your body. After 65, your body doesn't process medications the same way. Your kidneys slow down. Your liver slows down. And your brain becomes more sensitive. So the same dose you took at 45, now it stays in your system longer, builds up, and hits harder. Think of it like pouring water into a tub with a clogged drain. Same input, slower output, rising levels. And that's where the danger begins. Now, let's talk about the first medication. Drugs like Xanax, Valium, or Ativan. They're commonly used for anxiety or sleep. But here's the problem most people never realize: these drugs don't fully leave your system overnight. So even if you feel fine in the morning, your balance, reaction time, and coordination are still impaired. And studies show something alarming: these medications can double your risk of falls and fractures. Now imagine getting up at night, feeling normal, but your body isn't fully alert. That's where accidents happen. And it doesn't stop there. These drugs also quietly affect memory and thinking speed, even in people who believe they've adjusted to them. Let me ask you something: would you keep taking a pill every night if you knew it was slowly affecting your brain? Now here's the second one, and this might shock you. It costs just a few dollars, and you can buy it anywhere. Diphenhydramine, the ingredient in Benadryl and many sleep aids. Millions of older adults take this thinking it's harmless. But here's what it actually does: it blocks a key brain chemical responsible for memory. In simple terms, it doesn't help you sleep. It shuts down parts of your brain. And long-term use linked to a significantly higher risk of cognitive decline. Now think about that: a sleep aid that may quietly impact your memory over time. Still sounds harmless. Now let's talk about something almost everyone uses: ibuprofen, naproxen, pain relievers. They seem safe, right? But after 65, the risk changes dramatically. These drugs reduce blood flow to your kidneys, the very organ responsible for clearing them. Meaning the more you take, the harder it becomes for your body to handle them. And here's the scary part: kidney damage often happens without any warning signs. No pain. No early symptoms. By the time you notice something, it's already serious. And that's not all. These medications also increase the risk of internal bleeding, and can even worsen heart conditions. So the question is daily pain relief worth silent long-term damage? Now here's another one often prescribed for sleep: Ambien. It helps you fall asleep fast. But what most people don't know is this: you may wake up feeling normal, while your brain is still impaired. That disconnect is dangerous. Because your body reacts slower, even when your mind thinks everything is fine. And research shows this increases the risk of serious injuries like hip fractures. Now consider this: a single fall at this age can change everything. Finally, there's a medication almost nobody suspects: acid reflux drugs like omeprazole. They work well short-term, but many people stay on them for years. And over time, they can reduce important nutrients your body needs, like vitamin B12 and magnesium. Low levels of these can lead to nerve problems, memory issues, and even heart rhythm disturbances. So here's the real takeaway: it's not just what you take, it's how long you take it. Now here's exactly what you should do next. Write down every medication you use, prescription or not. Then take that list to your doctor and ask for a full medication review. Because your body has changed, and your medication plan should reflect that. And one more thing, never stop any medication suddenly on your own. Some require careful medical guidance. But ignoring this, that's the real risk. So let me ask you, how many of these are in your daily routine right now?